Infertility Care by Brittany Crisp. Infertility is the inability to conceive after 12 months of regular, unprotected intercourse. It affects about 10 to 15% of couples globally. Causes of infertility can be early menopause, when the ovaries stop producing hormones for ovulation. The fallopian tubes could be blocked, endometriosis, ovarian problems where the ovaries are not releasing eggs, low sperm count, erectile dysfunction, and damage or anomalies of the reproductive tract preventing the delivery of the sperm. Assessment includes collecting data such as reproductive history, sexual history, medical history, ovulation tracking, hormone profiles, semen analysis, emotional support, lifestyle habits, and testing such as ultrasound and HSG. Diagnosis of infertility. For the woman to be fertile, her ovaries must release healthy eggs regularly. Her reproductive tract must allow the eggs to enter the fallopian tube for fertilization, and the eggs must travel onto the uterus for implantation. For a man to be fertile, he must produce enough sperm to ejaculate into the vagina, and the sperm must be able to travel to the fallopian tube to fertilize the egg. Nursing diagnoses related to infertility include anxiety, impaired fertility, altered body image, and risk for ineffective coping. Planning includes reducing anxiety, promoting conception or adoption, improving coping mechanisms, lifestyle changes like exercise and dieting, treatment options, and support groups. Implementation includes educating the patient, discussing risk factors, administering medication, assisting with fertility procedures, encouraging open communication between couples, and providing emotional support. Evaluation. Were the goals met? Did the anxiety levels decrease? Did they make the recommended lifestyle changes? Were they satisfied with the fertility treatment process? Make sure to evaluate emotional well-being and coping strategies the patient uses. Outcomes to assess include whether the patient was able to get pregnant, how they coped through the journey, and their compliance with the treatments and recommendations given. Remember, infertility is common and treatable with several treatment options available. Emotional support and counseling are vital throughout the process. Question 1. The nurse is educating a couple who have not been able to conceive after a year of unprotected sex on the causes of infertility in women, which include which of the following? Select all to apply. Early menopause, ovulation disorder, varicocele, fallopian tube blockage, endometriosis. Answers A, B, D, and E. Question 2. The nurse is collecting data on a couple who have been unable to conceive in the last 12 months with unprotected sex. Which of the following information should the nurse obtain? Select all that apply. A. Information on the woman's menstrual cycles, results of hormone testing, results of semen analysis, results of ovarian egg count, reproductive history. Answers A, B, C, and E.